Are we prepared now to talk on air? Mga kaibigan po, ako ay mayroong bisita dito ng isang American. So, from time to time, I need to speak in English. So, maintindihan po ng lahat, di ba? So, kasama ko ngayon si Steve Jerkins. Siya po ay from California at narito rin ang kanyang butihing asawa na kamukha po ni sinong kamukha mo? Si Venus Ra.
I'll help you with the pronunciation. Jenkins.
Oh, Jenkins. Okay.
Jenkins. There
Jenkins.
you go.
Okay. So
people a lot of times say Jerkins.
Okay. So you want to say something about your about how's the condition of the Philippines right now? You experience the heavy traffic in the street along EDSA. So what can you say?
You know, well, like we were discussing, Indonesia is worse. So you know, you can always think of the bright side.
Yeah.
That it's not the worst, but it was pretty rough getting here. Yeah, I would say.
Mm-hmm. So are you planning to stay longer in the Philippines, or are you going to have it back? Yeah, going back to
Well,
California.
if I did what I'd want to do, I'd probably be somewhere up in the mountains where the air is fresh, and you know. But God calls us to a lot of different places in the world.
Mm-hmm.
And this country is near and dear to my heart, and the people here I found them to be very nice. So I have a dream and a concern for their health, and a dream to be taught here, but also to educate when I get a chance.
Okay, that's good. At least you are familiar with the Filipinos, especially your wife is a Filipina, a beautiful one. So you're lucky enough to have a beautiful Filipino wife. Okay.
Thank you.
So more on the Philippines. What can you say more about the people, the condition, and everything that you have been observing us?
Okay. Well, I really appreciate that the fact that Filipinos love Americans usually, and in most cases, and they look up to us as kind of liberating them, you know, during the war.
Wow, yeah.
But there's a negative side to Americans, which is their diet and lifestyle, which affects their general health, and it's crept over into other countries.
Yeah, we copied, or we just having those cultures. We copied some cultures from Western.
Yeah.
Western cultures, should I say?
And it's affecting the health of the people, and the children.
So, what are the common, should I say, or the similarities of
Illnesses?
American and Filipinos?
Well, similarities. Heart disease is the king of diseases when it comes to killer diseases, things that affect people and the health in general of an area.
Sure. Okay.
So heart disease.
So heart disease. Okay, mga kaibigan, kami po ay umpisa na sa aming rangkadahan dito ngayon, pero meron nag-text sa atin from Villamor Air Base, ang ating mga friends dyan na nakikinig ngayon. At na-late kami. Ayan. Binabati ko si Amy, ganun po si Ellen, sila po ay nakikinig sa atin, at sino pa tong iba, at hindi ko na masyadong nakikita, no? Pero batiin na lang natin ang ating pong mga friends, mga Dilatory family dyan sa Villamor Air Base. Kung mayroon po kayong mga katanungan sa discussion pong aming tatalakayin mamaya po, ay pwede po kayong tumawag sa aming mga numero. Nais ko pong dahan-dahanin ko siguro, no? Sa line 1 po, pakitanong mo nga itong isa, naputol yung isang last digit. Sa ating line 2, 6312647. At para sa ating mobile, 0918-925-7980. Okay, nakapagpahinga na kaya itong kasama natin? Okay, to start with, I would like to know more about you, Steve. Could you please tell us something about what have you been doing in the United States? So, your previous work?
Okay, interestingly enough, my father, he was born in 1905. Okay, so he's deceased, but he lived past 100 and in good health. And his father, my grandfather, was a doctor who worked with John Harvey Kellogg, the founder of the first Seventh-day Adventist Sanitarium Hospital, which, of course, you know, Manila has an Adventist Sanitarium Hospital called MAMC, Manila Medical Center. So it's kind of in the genes, in the blood of my veins to be interested in the cause and prevention of disease and how to be healthy. I saw it with my father, and so my interest to become a doctor changed as I started to realize that the key to health is a little bit different than drugs, surgery, medications, things like that. And so my background is not a doctor, but it's been enmeshed in and just living and growing up in a culture, in a family. For example, I'm a strict vegan from birth. My father was a strict vegan from birth. So I've never eaten anything with a face, anything that can look at me with eyes, or anything from that. And so I've lived it. My father lived it. And when you live that lifestyle, you start to see the miracles of people getting well on a regular basis.
Let's talk more about that. Then I'd like to know more about, you've said a couple of days that you were also engaged on television, on radios in California. What is it?
Well, for a while people thought and called me a TV personality, but I wouldn't go to that extent. I had some infomercials and commercials that were basically public announcement commercials, not selling anything, but giving an idea for free. For example, this simple idea: getting well is simply a matter of stopping from doing what is making you sick and start doing things to get well. And so, of course, there's some different opinions and ideas. But I ran a health center for 16 years.
16 years?
And I was not the doctor, but I had 3 doctors working under me, and several of them quite notable, and around the world, and in the Philippines. I guess I could mention the names probably. Dr. Eileen Luddington was my mentor, I guess you could say, my health mom who raised me and helped me in the little clinic that I started. And I call it a clinic here because that's what people understand. But in the United States, we call it a lifestyle center or health education center.
It sounds good, lifestyle center.
Well, see, because getting well really takes the cooperation of the patient, more so even than the doctor. Doctors tend to give up on the patient because, on them trying to getting the patient to make the changes in their life. For example, quitting smoking. If a doctor spent all their time trying to get people to stop smoking, it would be problematic financially because it's such an addictive habit. So, but that's a cause. That's a cause of disease. And so obviously people need help to stop smoking. So that's a lifestyle center.
And we can also teach how to stop smoking, maybe in some other topics, or
another time. That's a great subject.
So let's start now to discuss our main topic today or tonight. And I would like to ask you, what are the common or the prominent, should I say?
Prominent?
Yeah, meaning the killer diseases nowadays.
Well, it's interesting. More than 100 years ago, diphtheria, influenza, tuberculosis, pneumonia, those were infectious diseases that dominated the world. And, the bubonic plague, and there's some history behind us, and polio and things like that affected us as a nation in the United States and probably here in the Philippines. But there was a shift as antibiotics and medications. I can kind of use the word improve, however, it's still not the answer. But because of those things, there was a shift in the types of diseases, and there was more lifestyle-based diseases. So then it became heart disease, cancer, diabetes, and strokes increased, which heart disease and strokes are pretty much in the same category because it's all a clogging of the arteries or the nerves or in the brain.
So can you tell us what's the lifestyle of American people? How
Well, we call it the SAD diet.
What's that?
Standard American Diet.
Okay.
SAD. The SAD diet. So,